Hello, my name is Ginny Brant at Unleash Your God-Given Healing. Today I would like to share with you 6 tips for making it through chemotherapy with a much better prognosis. I have to admit that chemotherapy was something I never wanted, and these things made me feel better about going through it. The first one was something that my husband and I just learned to do throughout life when a crisis hit our life. My husband laid his hands on me before each chemotherapy and prayed for God to use these chemicals to kill the cancer and for me to be able to do well through the treatments. My husband, in addition, he actually prayed and fasted throughout the entire day on my behalf. And I'm very thankful that he was willing to do that. The second tip I'd like to give you today is something that my naturopathic doctor and nutritionist told me to do to help overcome the side effects of chemotherapy. They told me to increase my hydration 2 days before, the entire day of chemotherapy, and 2 days afterwards. Now, proper hydration is technically your body weight divided by 2 in fluid ounces. So for me, that would be 75 ounces of water a day, but I was to increase, I would add 3 or 4 more glasses to that. It assured the chemo would get to every cell. It enabled my body to remove the toxic chemicals after they had done their job and greatly lessened the side effects of the chemotherapy. The next thing that my naturopathic doctor and my nutritionist told me to do was I must make sleep, deep sleep, a priority. Now that's difficult when they're giving you sometimes steroids and chemicals before the chemo, which kind of keep you up at night. But they said if I could engage in deep sleep and make it a priority, I would fare much better. And if I didn't, I would not be able to recover from what these chemicals were doing to my body. You see, it is during deep sleep that our bodies heal, repair, detox, and regenerated. And I needed all of those working in my favor. So deep sleep is very important. Now the next tip came from my friend Joni Eareckson Tada. You see, I interviewed her after her cancer journey. She's one of my favorite people to interview. And I asked her this question, not knowing that the next year I would need to know the answer. I said, Joni, what advice would you give to someone who was facing chemotherapy? And she said with a smile on her face, she said, have a positive attitude. Go into chemotherapy thinking positive Christian thoughts, relying on the Word of God, listening to inspiring Christian music, reading Christian books, all of these things. And she also said, look for people around you that you can minister to. You know, this is 5 to 8 hours of chemotherapy. You can walk around while you're getting your chemotherapy and try to comfort and lift up other people, which also lifts your spirits. So I took Joni's advice, and instead of singing in the shower this song like this, oh, poor, poor, pitiful me, poor, poor, pitiful me, what are these chemicals gonna do to me? Lord, have mercy on me. Woe is me. That's not the way I went into chemotherapy. Instead, I'm in the shower singing God's praises. Music has helped Joni with so many trials in her life. And having that positive Christian attitude does make a difference. Another thing told to me by my naturopathic doctor was, no matter what I did, I must keep my bowels moving. Now, chemotherapy you can go either way. Either you have diarrhea or you can get backed up and have constipation. I kind of knew which one from history was going to happen to me. And so after the first chemo, you kind of know which way you need to prepare. And it's important that if you know you're going to get constipated, that you keep those bowels moving. The hydration helps, movement helps, and my doctor also recommended Miralax or some type of even natural laxative to make sure you keep your bowels moving, because if you get backed up, all those chemicals can be reabsorbed into your system, giving you all kinds of toxic effects, and we don't want that to happen. The last tip, number 6, is something that I did to relieve stress, and that's very important. I decided after walking 2 miles before and after each surgery was so good for me that I would do it to relieve stress for the one thing I never wanted in life, chemotherapy. So I walked 2 miles before each chemo, and if I could, I wanted to walk 2 miles afterwards. I want you to know that it greatly relieved stress. And I was able to walk the 2 miles before and the 2 miles afterwards, every day of chemo, every day in between, and all the way through the entire year of chemotherapy and other infusions. And I consider that a praise and a blessing from God. But the interesting thing is this. Several years later, my doctors, right after chemo, called me their rock star cancer patient because my red blood cells, white blood cells, and platelets were back within normal ranges in just 6 weeks. This can take years. And they said, "We know why you did so well with chemotherapy." I said, "Why is that?" They said, "Look at the new research in Australia." And then later I found research at MD Anderson. And guess what they're saying now? The best thing a cancer patient can do during chemotherapy is to move as much as you can. Do not be sedentary. If exercise were a pill, it should be given to every cancer patient worldwide. So this is a big change in chemotherapy. I didn't do it because I knew about the exercise research. It wasn't done then. I did it to relieve stress and got a much bigger bonus. I hope that these 6 tips will help you. Please remember to like my new YouTube channel, like this video, subscribe, and hit the notification bell when I do make a new video. Because next time, I'm going to tell you the things I didn't know during chemotherapy that would have made my prognosis even better. This is Ginny Brant, Ginny Brant on YouTube, at Unleash Your God-Given Healing. Please share this information with those family, friends, church members that you love that are facing chemotherapy. God bless. Thanks for your time.